Master the art of effective communication by exploring the key distinctions in verbal versus nonverbal communication. Effective communication is the cornerstone of quality healthcare. It encompasses both verbal and nonverbal methods, which together shape how messages are sent, received, and understood. This course explores the nuances of verbal and nonverbal communication, their critical roles in patient care and teamwork, and provides healthcare professionals with strategies to enhance their interpersonal skills, improve patient outcomes, and foster a positive work environment. Introduction to communication in healthcare. Communication is a dynamic, multifaceted process essential for delivering safe and compassionate healthcare. Definition: communication is the exchange of information through words, actions, or symbols. Importance in healthcare: ensures accurate patient assessment, treatment compliance, emotional support, and teamwork. Elements of communication: sender, message, medium, receiver, and feedback. Communication models: linear and transactional models highlighting the two-way nature of communication. Healthcare context: diverse settings, sensitive topics, and high stakes demand effective communication skills. Understanding verbal communication, components and techniques. Verbal communication involves the use of spoken or written words to convey information. Components: language, choice of words, clarity, tone, and pace. Grammar and vocabulary, using appropriate and understandable language for the audience. Tone of voice, conveys emotion and intent, can reassure, calm, or convey urgency. Active listening, engaging fully with the speaker through feedback, paraphrasing, and questioning. Techniques for effective verbal communication. Speak clearly and at a suitable volume. Use simple language with patience, avoiding medical jargon. Confirm understanding by asking open-ended questions. Provide clear instructions and explanations. Practice empathy and patience in conversations. Understanding nonverbal communication, types and significance. Nonverbal communication includes all the unspoken elements that accompany or substitute verbal messages. Types: facial expressions, convey emotions like happiness, sadness, fear, or confusion. Gestures: hand movements or body language that emphasize or replace speech. Posture and body orientation indicates attentiveness, openness, or defensiveness. Eye contact signals interest, honesty, or sometimes discomfort. Proxemics, use of personal space, respecting cultural norms about distance. Touch can communicate care, comfort, or professionalism. Paralinguistics, elements such as pitch, tone, loudness, and rhythm of speech. Significance in healthcare. Nonverbal cues often reveal true feelings or concerns. They can reinforce or contradict verbal messages, critical in assessing patient emotional state, pain, or discomfort. The interplay between verbal and nonverbal communication. Effective communication requires alignment between what is said and how it is expressed. Congruence. When verbal and nonverbal messages match, communication is clear and trustworthy. Incongruence. Mixed signals cause confusion or mistrust. Example: saying "I'm fine" with a distressed facial expression. Examples: a calm tone paired with reassuring touch can comfort anxious patients. Lack of eye contact or crossed arms may indicate disengagement. Healthcare impact. Patients often rely more on nonverbal cues to judge sincerity. CNAs must be aware of their own nonverbal behaviors and interpret those of patients accurately. Recognizing and interpreting nonverbal cues in patient care. Understanding patient nonverbal communication improves care quality. Observation skills. Monitor facial expressions for pain or confusion. Notice changes in body language signaling discomfort or fear. Respect cultural differences in gestures and touch. Responding appropriately. Adjust communication style based on cues. Use comforting gestures like a gentle touch when appropriate. Provide space or reassurance as needed. Examples: a patient avoiding eye contact may be in pain or embarrassed. Restlessness or pacing might indicate anxiety. Effective communication strategies for healthcare professionals. Practical strategies enhance both verbal and nonverbal communication skills. Building rapport. Use open body language, smiles, and attentive posture. Clarifying messages. Summarize patient statements to confirm understanding. Cultural competency. Adapt communication styles to cultural preferences. Dealing with difficult conversations. Stay calm, listen actively, and use empathy. Nonverbal self-awareness. Monitor your tone, facial expressions, and gestures. Using technology. Ensure clear communication through telehealth or documentation. Overcoming communication barriers and misunderstandings. Barriers can hinder effective communication in healthcare. Common barriers: language differences, hearing or speech impairments, emotional distress or cognitive impairments, environmental distractions, personal biases. Solutions: use interpreters or translation tools. Employ written materials or visual aids. Speak slowly and clearly. Create quiet, private environments. Practice patience and empathy. Managing misunderstandings. Use feedback loops. Encourage questions. Restate or rephrase information. Enhancing interpersonal skills for patient and team relationships. Interpersonal skills foster teamwork and positive patient interactions. Building trust, consistency, honesty, and respect. Empathy, understanding patient feelings without judgment. Conflict resolution, address misunderstandings calmly and constructively. Collaboration, sharing information effectively with the healthcare team. Professionalism, maintaining boundaries and respectful communication. Conclusion and recap. Mastering verbal and nonverbal communication equips healthcare professionals to deliver patient-centered care, build strong team dynamics, and navigate complex interactions with confidence and compassion.